For this week's edition of our segment on dentistry, we're going to talk about the benefits of getting dentures. Joining us once again is Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas. Dr. Bruce, good to see you again.
Good to see you too, Dave.
Well, I know with dentures, we talked about, if people start losing teeth, if you lose several teeth, you have many issues with teeth loss, that's when you may want to consider dentures.
That's true. If you're in a situation where you have few teeth on top, few teeth on the bottom, and what you have left are badly decayed, you might want to consider dentures. Obviously, we try to save teeth whenever we can, but you get to a point where it just can't be done anymore, and you need to think about dentures at that point. And
doctor, when you lose a substantial amount of teeth, you mentioned that there are some issues that you start to develop.
Well, you lose support for your face. I mean, a person who has their own teeth, the face, the vertical dimension of the face is a certain amount, and it's what it was designed to be. As you lose teeth, that vertical dimension diminishes, and your face becomes pushed together. Wrinkles become more obvious, and you just look older.
Now, dentures, there are things you have to do to maintain them. You do recommend, taking care of them and then possibly replacing them every so often. What are the rules of thumb there?
Well, a rule of thumb, once a denture's made, within 7 or 8 years or sooner, but certainly within 7 or 8 years, the tissue under the denture changes. It becomes smaller, it shrinks a little bit, and it changes various ways. And this is a normal metabolic process, and you might need a reline of the denture after that amount of time. A denture, once it's made, isn't good for 30 years. Some people try to do that, and it creates a lot of problems with the denture. So if you have it relined after 7 or 8 years, it generally fits better, it's more comfortable, and it looks better, and it will function longer.
Another consideration is the fit of those dentures. And, you mentioned about adhesive. You say that if you have your dentures fit properly, there really is no need for adhesive.
Generally, that's true. You get to a point, if you have a healthy ridge, when the denture is taken out, if the surgery is done optimally and you don't have a lot of infection, those ridges will be nice and strong. They'll last a long time, and you really don't need dentures, or you don't need adhesive, rather. And those dentures will stay in just with suction, particularly the top one. The bottom one's a little more difficult because you have a tongue to contend with and muscles, and you just can't get the suction. But generally, you can get the stability, or even on the lower denture, it doesn't need to be held in by an adhesive.
And doctor, I know all of us try to look younger. The advantage of dentures, it gives you a more young appearance.
Absolutely. It maintains the vertical dimension, or restores the vertical dimension if it's been lost. And those wrinkles that formed when the vertical dimension changes, you can eliminate some of those with a proper fitting denture. I also neglected to mention last time in a previous question, you should have the dentures relined after 7 or 8 years. Generally 12 to 15 years, you should have a new pair. By that time, you've been wearing them so long, they're stained, they don't fit nearly as well, and to reline them a second time can create other problems. So after 12, 15 years, you really think about a second denture at that point.
All right, for our viewers that have more questions or need some help with dentures, how can they get in touch with you?
Well, I have a website, drgoeringer.com, or they can reach me on my phone number, which is 570-675-3646.
All right, Dr. Bruce Goeringer from Goeringer Family Dentistry in Dallas. As always, pleasure talking with you.
Always a pleasure talking to you, Dave. Take care.
You too.